Hello, welcome to Insight. I'm Pastor Messi, your host. If you are a regular viewer of Insight, you know that something is different about today's episode. On a normal day, Insight doesn't do live audience, but there is a live audience right in the house. Can you give yourselves a round of applause? Wow. Today's topic of discourse is very, 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 very important. We're going to be looking at fertility and childbearing. Fertility and childbearing. You know, it's supposed to be a natural process, a natural thing for a man and a woman to come together in matrimony, mate, get pregnant, and give birth. But today, it has become a Herculean task. Childbearing has become, an uphill task. In some families, it has become a mission impossible. It ought not to be so. So any area of your life where you lack the right information, where you lack light, where you lack knowledge, you will definitely walk in the dark. You'll stumble against obstacles that light would have helped you to locate. Wow. So today, we have a very special guest in the house that will be explaining to us what this topic is all about. And we're going to have 2 episodes. The very first one, they are going to be talking to us about fertility, what it is and what it is not, and the factors responsible for infertility among couples. And then the second episode, they are going to be talking to us about the solutions, what we can do about infertility. Are we good? Okay. In as much as we know that infertility among couples could be multifactorial, but first factor on the list, as far as I'm concerned, is ignorance. So we want to handle ignorance right here. So after this break, we shall be introducing our guests for today. Welcome back. This is Insights, and my guests today are ladies first.
That's right.
After the men.
Somehow.
Okay, I start, introducing the lady. She is an embryologist, and she's going to be telling us what, that is about. She is Adesua Ugbebo Evans, an embryologist.
Yeah, correct.
And he is the chief medical consultant at DIFF Hospital Abuja, an obstetrician and a gynecologist. He is Dr. John Idahosa. Great to have you on Insights.
Thank you.
We're so delighted to have you on Insights.
Thank you.
And we're talking fertility and childbearing among couples. So why has it become so difficult? People have gotten married since, or for the past 25 years, 20 years, 15, 14, 7, 8, 4, and so on. Dr. John, what is the matter?
Well, thank you.
I'm going to give you ample time to explain what this thing is about. Right. So I won't be interjecting with questions. After your explanation, you'll be given opportunity to ask questions. So get your questions ready. That's why they're here. They're here to answer your questions.
Well, thank you, Pastor Mercy, for creating this enabling environment for people to be informed. I agree with you that the difference between people has to just do with information, because the devil can only steal in the dark of a man's ignorance. No wonder Isaiah said in Isaiah 5:13, my people are taken into captivity. It's because they lack knowledge. And Hosea put it very correctly also in Hosea 4:6 that my people are destroyed. It's because they lack knowledge. So knowledge is something that is key. Well, your introduction did suggest that infertility is on the increase, and you're correct, because there has been a remarkable change in our lifestyle. Ordinarily, when you marry or you are sexually exposed, unprotected for 1 year, we expect a pregnancy to come out. But now it's not like that. Something has happened. There's a shift. A woman is considered to be infertile, or a couple is considered to be infertile after 1 year of regular unprotected sexual exposure. When we say that regular unprotected, what does this mean? It means this woman is having sexual relationship 3 to 4 times in a week. And that translates to 12 to 16 times in a year. That translates to in a month. And that translates to 196 sexual exposures in a year. Before you will say this couple have a problem. But change in the system, now we have people, husband is living in Abuja and wife is living in Lagos. And they meet only during what the woman considers as her ovulation period. From common biology, you would think that a woman who menstruates every 28 days should ovulate on the 14th day of her cycle. It doesn't work that way. We had to teach that in common biology so that people can just have a little bit understanding of how the human body works. Yes, in the lower animals it works that way, but in humans it doesn't work. It's possible for a woman not to ovulate and yet she menstruates. And that's just how it is. Now, it is true that about 30% of our couples now marry and they just don't have pregnancy. And you wonder, why is it on the increase? It's on the increase because the commonest reason why our women don't conceive is also on the increase, and it has to do with sexually transmitted disease. Now, for a woman to conceive, she needs fallopian tubes that are patent, in other words, they are open. She needs ovaries that are functional. She needs a uterus that is capable of allowing the embryos to implant. She needs to have a vagina that has an enabling environment to allow sperms to stay. She needs to have a cervical mucus that will allow sperms to move in swim through into the fallopian tube. She also needs to have a husband, or have a spouse, or have a male who can deposit sperm into the vagina. And we're not talking about 10 million sperms, we're talking about 60 million sperm cells rightly deposited in the vagina, and then allow those sperms to swim. So which means if there is an increase in infertility rate compared to what it was before, so many things have happened in this area. The commonest reason why our women don't conceive in Nigeria, in Africa, is blocked fallopian tube. The tubes are blocked because of infection. We still live in a society, in a community, because of the trappings of our background, where people are having low abdominal pain. Maybe they have just some background pelvic inflammatory disease or infection. They just go to a chemist and buy medications. And so you have a lot of our women having some degree of having some partially blocked fallopian tubes, or fallopian tubes that are not doing very well. Again, our women deliver in places that are not very clean, and so they have the first child. The second child doesn't come because the fallopian tubes have been exposed to infection, infective and microorganisms. We have to appreciate that the fallopian tube is not an expressway. It's as tiny as a pinhole, so it can get easily blocked. The fallopian tube also have some very tiny finger-like materials that aids the movement of sperm towards the end of the tube for pregnancy to take place. You know, most people think that pregnancy starts in the womb, but no, pregnancy does not start in the womb. Pregnancy starts in the fallopian tube, towards the end of the fallopian tube. All right, so a woman's fallopian tube can get blocked, again, during one of those surgical procedures. You're doing a fibroid surgery, you had a cesarean section, you've had an appendicitis, and they're doing an appendix surgery, and suddenly your tubes are affected by the procedure, or it gets scarred. So you see that, you see why it's on the increase. It's not going to be on the increase because the incidence of post-abortal sepsis is increasing. People still manage to go and terminate pregnancies, or attempt to terminate pregnancies, in environments that are not sterile. And each instrument you take into the uterus exposes the fallopian tubes to damage. So when you put those factors together, you understand that there must be an increase in the number of tubes that are exposed to being blocked. Now let's take the ovaries. The ovaries are just a pair of organs that God deposited in the woman that makes the woman the woman. The ovaries do a lot of things for the woman, you know. It contains her egg store, but it also provides the hormones that the woman needs to be who she is. Oh, her hair, her skin, her shape, her voice, her demeanor, her character. Those things are all being executed by the ovaries. When a woman is still in the womb, God made a provision that she has a lot of eggs, about 3 million eggs. If each egg is to translate to become a child, each of you will have about
3 million children.
3 million children. With 3 million children, I wonder what Lagos will be. So I'm sure each of us will be moving by the side, sideways. But God also made a provision that before the girl gets to 12 years, she would have lost about 1.5 million of those eggs. To make her who she is, to begin to engineer her development until she sees her first menses. A lot of eggs have sacrificed their lives to make her what she becomes at the age of 12. Now, from the age of 12, nature made a provision that about 30 eggs every month should go through a development process, but only one gets to maturity, and that one is ovulated. So a woman is considered to be in her reproductive age group when she still ovulates, and that starts from the age of 12 till about the age of 40. There is no woman who is above the age of 40 that ovulates every month, because nature did not make a provision for that to happen. All right? So, if anything interferes with this process that allows eggs to go through a maturation process and then ovulation, then that woman is infertile. She may have the eggs, but they are not being released. Now, the process, the mechanism that initiates the development of the egg starts from the brain. It is the brain that sends the signal to the ovaries and tell the ovary, this woman has started menstruating. Day one of your menses is the same, is equal to day one of egg recruitment and development. What am I saying? The day a woman starts menstruating, day one, so many things are happening in her body. It's like you engage a car on a gear. So many things happen before the car starts moving. When she starts menstruating, the body starts producing a new set of eggs to replace some other things that are happening in her body. So, if that process is not well coordinated by the brain does not release enough hormones, or because of stress, because of our sight, because of our work, because of heat, because of quarrels in our home, because of the stress of the environment, because of the challenges of our job, that woman is just young, but she's not producing eggs. She's not releasing the eggs every month. So, or the woman has what we call a polycystic ovarian disease, or the woman has an ovarian cyst. You see, polycystic ovarian disease is the leading cause of inability for a woman to ovulate every month when she's still in a reproductive age group. Then what is this polycystic ovarian disease? What is it all about? Nature made a provision. When I say nature, okay, let me put it this way. God made a provision that the eggs of a woman should be arranged in such a way that they should give themselves space to express themselves. In a woman with a polycystic ovarian disease, the eggs are arranged in such a way that they are not able to develop properly and ovulate. While we were in the medical school, I graduated from the medical school maybe 30 years ago, or 31 years ago. We were taught that the polycystic ovarian patient can easily be recognized by the fact that she's fair, she's infertile, maybe in her 30s. But now we know that there's an increase in polycystic ovarian disease. Now we begin to see it in our, guess what, 18 years. And what has happened? It will not be unconnected with the food that we are eating. It will not be unconnected with the exposure of our women to the toxins. These days we all take plastic things that are stored in plastics and left in the hot sun, and then we drink them. It will not be unconnected with our laundry. Every home now has a laundry, and now we also know that some of those whiteness in the detergents do contribute to they get into your body system, and before you know it, your ovaries are just not functioning well. Polycystic ovary
can get into,
yeah, because when you finish, after you've washed your clothes and you have rinsed them with a machine, you dry them, there's still a little part of it left that makes direct contact with your skin. And yet there is no child, there's no girl child these days that goes to a home that you're not going to give a washing machine to. We all drink things made in plastics. You travel a lot, you understand that these plastics are stored in cool environment, because we know that when these plastics dissolve, they also release some of those hydrocarbons into what you're going to drink, and those things you drink them thinking that nothing has gone wrong. Something has gone wrong. All right? So You will understand that over the past 20 years, these things, plastic and the use of them has increased. So the incidence of polycystic ovarian disease has increased. Now, we also now have ovarian cysts. Many women developing ovarian cysts either because they are having infective cysts or the phenomenon of the polycystic ovarian disease or inadequately done surgeries, creating an enabling environment for cysts, ovarian cysts to develop. Let's not talk about the many other reasons why women will develop ovarian cysts. But the bottom line is that all these things will now result in anovulation, that is inability of the woman to ovulate. Then you think about the uterus. The uterus is the womb. That's where the baby has to stay. The baby needs a very nice environment to stay. So a woman who has had a surgery, naturally, you have scraped the womb, you've left a scar. You've had an infection, you've left a scar. You have a fibroid, there is a mass there. It interferes with the ability of the embryos to implant. You also need to have a cervix. The cervix is the neck of the womb. It contains cervical mucus. God designed that the mucus should be like a sieve. It should help to separate microorganisms from sperm cells. But there is a level of exposure to microorganisms that cervical mucus now contains a lot of antibodies that treat the spouse's sperms as foreign substance and microorganisms, and then they trap all of them there. You know, these days, women apply a lot of things in their vagina. I mean, people want to perfume their vagina. For what? I thought the vagina is supposed to have a normal pH. So, a man deposits semen inside the vagina. The vagina, it's understandable, is supposed to be acidic. Understandable. But by the time you begin to do too much of douching, you begin to apply too many caustic materials into the vagina, it does change the pH of the vagina from this level of acidity to more acidity, and then a man deposits semen into the vagina. Nature demands that the sperm cells should be there for a few minutes, and then all the sperm cells are dead because of the acidic environment. See, I've talked about the women, but unfortunately in Nigeria, the commonest set of people that are now contributing to infertility are the men. In the medical school 30 years ago, when you say a couple is having difficulty in conceiving, we'll say, oh, it's the woman. 40% was, the women were responsible, 40% of the cases. Now, the reverse is the case. Most men are, 40% of causes of infertility, the male factor. 30%, the women. 15%, both of them. 5%, you cannot find any cure. You can't just find any cause. Whatever the cause, I'm still going to discuss this male factor, whatever the cause of infertility in this day and age, there is no woman on this earth, there is no couple on this earth that is barren.
Wow.
I want you to understand.
There is no couple in this world that is barren. After this break, we'll be right back and he will continue from where he stopped.
Level Plus app is bigger and better. Watch all our shows with just a click.
Let him have the right to decide what happens with your body.
Watch inspiring, informative, and entertaining programs. You can comment, like, and share. Watch your live TV and web TV on your mobile devices. Watch the big stories in real time or when you have the time. Experience Level Plus app right now. Download Level Plus app on Android, iOS, and BlackBerry. Go to Google Play Store, Apple App Store, or Windows Phone Store. Welcome to the bigger picture. Level Plus, beyond television.
Welcome back. This is Insights. We're talking fertility and childbearing. My guests are Adeswa Obe and Dr. John Idahosa. Over to you, Dr. John.
Okay, glad to be back. Exodus 23:26. God told a nation that has just been delivered from Egyptian bondage that none of you shall be barren. God went to the extent and said, not even your cattle shall be barren. In Deuteronomy chapter 7 verse 14, God further pressed it down and said, neither your males nor your females will be barren. We are that generation that has seen the fulfillment of that prophecy. When God says a thing, he means it. He puts the enabling environment to make sure his word does not return back to him void. If you see any woman, if you see any man whose head is bent down by the tears, the shame, the despair of infertility, her real problem is poverty and ignorance. Irrespective of a woman's age, irrespective of her gynecological condition, as long as she has the inner will and courage to say, I want to be pregnant, I believe every woman on this earth has the chance to be pregnant. Now, talking about the male factor, God made a provision also that the man should be able to produce semen. When you say semen, semen is that fluid that a man ejaculates. It is a product from 4 different organs. One is the testis. God made a provision that at each act of ejaculation, we should have about 2 to 3 mils of semen. 0.5 mil of that comes from the testis. The testis produces the sperm cells. But the sperm cells are like, you produce a fish, the fish needs to be in water to survive. So, the prostate gland supplies some fluids. The seminal vesicles supply, the Cowper's gland supplies before it comes out. We are now having men who have semen without sperm cells. So, what has happened to their testes? God made a provision that the testis will have a very unique blood supply, so as to make sure at every given time the testis is 1 degree centigrade lower in body temperature, than the other parts of the body. Now, God did it in such a way as, apart from just making the blood supply unique, God also dropped the testis into the scrotum to make sure that the testis does not have contact with the body. But now, things have changed. What are our men doing? Our men are heating up their testes. Men now go into, you see the laptop? Take a man, put a laptop on your lap, do that for 30 minutes every day, for 6 months, you test your sperm count, it's going to be low. Not that it may be low, it's going to be low.
Wow.
So, which means you generated the heat that destroyed your testes. Now, you see that one of the ways you know maybe you're doing well is you sleep in a hot water bath, you fill the jacuzzi with water, warm water, and you're just inside. It's meant for women. Men don't expose their testes to heat. When you look at the sperm count of the average long-distance driver and the non-long distance driver, you notice that the sperm count of the long distance driver is lower, simply because the testis has too long contact with the skin. And then, to make matters worse, our women will now wear some tight pants, as if they want to hide something which we already know is there. All right, so that does again reduces the sperm count. So you see that everything we're talking about so far has to do with the things that the man does that is responsible for a low sperm count. Those days when we were young, our mother gave birth to us. They allowed our testes to have freedom of expression. Now, the young mothers will give birth to children, and use pampers to bring their testes close to their body. No, the way you pad a male child is not the same way you do with a female child. The way you bath a male child is not the same way you handle a female child. Okay, so that's all about heat. There are also some medical conditions that can expose the testes to heat. I told you that God made the blood supply in such a way that it's a kind of current. In the other parts of the human body, the arteries will bring blood, flow through the capillaries, and then the vein takes the blood away. In the testes, the artery and the veins, they just run side by side, so that at every given time, the testis is air conditioned. When there is a dilatation of the veins, it allows blood to stay a little bit longer around the testes, and that creates heat. Now we also have situations where young men are playing, they use something to heat the testes. You think it's just one of those events. No. When the testes of a boy is hit by an object, I think that guy should go and check what has gone wrong. It's not a singular event in his life. Now we talk about infection also. Just like women are exposed to infection, so men can get infection of the testes called orchitis. There is this immunization every boy child should be given. It's called immunization against mumps. It's supposed to be cheap. It's available everywhere. But you give birth to a child and you do not do a complete immunization schedule, and the boy child gets infected by the mumps virus. Yes, you may not know. All you will just see is that the boy had a swelling around the parotid. That swelling there may also have affected the testes. In the future, that boy is going to be infertile. Right? That's just for the mumps. Now, if you go to the other parts of the male reproductive system that contributes to the semen, you have the prostate. But the testis, when sperm cells is produced by the testis, it has to be transported to the seminal vesicles to receive some support. If there is a blockage in that tube, the man will produce semen, but there are no sperm cells inside. That can happen either because of infection, or when the boy child was going through a hernia surgery. That pipe is so tiny that it can easily be picked by the surgical needle, and then that boy is infertile. That's it. And then you go to the prostate gland, prostate infection, you go to the corpus gland, corpus infection. Now let's talk about smoking. Smoking reduces sperm count. Alcohol consumption does reduce sperm count. Now, we now live in a very stressful environment. A lot of our men now depend on sleeping pills to sleep. And I think the simplest one they go to take is Piriton. Each tablet of Piriton you are taking to aid your sleep is contributing to your infertility in the future. Now, because of the stress in our environment, a lot of people are beginning to have ulcer. These anti-ulcer medications can also contribute. I really think that virtually, let me not say all, but a lot of our men on antihypertensive drugs and anti-diabetic drugs are going to end up with abnormal sperm parameters. And that's why you see these things a lot. You would have observed that a lot of the men that take antihypertensives and anti-diabetic drugs, anti-ulcer medications, when you do the sperm parameters in the laboratory, you tell them what you see so that they know that when you take antibiotics, be very careful, because some of these antibiotics can also lead to infertility.
I think basically the normal proportion of normal sperms to abnormal sperms are lower in men that take antihypertensives and antidiabetics, because most times when you look through the microscope and you look at the sperms, they have abnormal looks. You have some with double heads, double tails. Some of them you don't find their acrosomes. The DNA is much more fragmented when you're dealing with men that are on such medications. So, but the part of it that is most interesting is Male infertility over the years, when you do a lifestyle modification, it shows, because the men are lucky, unlike the women where you have the number of eggs you produce in a lifetime given to you at birth or during your pre-developmental stages. For the men, you produce sperm every 90 days. So if you make a swap or you have a turnaround or modify your character or your lifestyle, it shows automatically when you're, if you give yourself a number of months and you have new sperm cells being generated. So you find out that the coast is clear. So for men, it's always easier to deal with if you've not had a permanent damage. But if it has to do with medications, sometimes you can't really do anything about it, because you can't take him off his antihypertensives, you can't take him off his diabetic medications as well. So you have to work with what you have. So that's what makes male infertility very difficult to treat. But for young stars, it's a lot easier. You quit smoking, you reduce your stress level, you quit drinking. Naturally, it should translate 90 days after for you to have more normal sperms that can fertilize eggs.
And in times like this, when the stress level is on the increase, you just wonder, because it increases the prolactin level, it increases the cortisol level, and once a woman has an increase in her prolactin level, nature treats her as if she's pregnant or breastfeeding. That's the problem. Once your prolactin level, it is the prolactin hormone that you use that enables you to breastfeed. And when you are breastfeeding, the chances that you get pregnant is slim. So I want you to understand, men and women, that stress does increase your prolactin level, increases your cortisol level. They interfere with ovulation for the women. They also interfere with implantation. Because we see that in women who have increased prolactin level, even when we can use the in-vitro fertilization technique.
Hey.
Yes.
Dr. John.
Yes.
You break it down.
Okay.
We're not used to, these medical terms. So bring it down.
Okay. So, prolactin is a hormone produced by the brain in response to stress, to prepare you for stress. If in this beautiful studio, if a snake suddenly appears here now, I think 70 to 80% of you will not see your menses for the next 6 months. Just the shock takes away your menses. What mechanism? How did it happen? Your prolactin level shot up and suddenly you stopped ovulating. And this is what also happens. There are women who are constantly under stress. They are under stress because their husband will not allow her be. Even if their husband will allow her be, we have a father-in-law, we have a mother-in-law, we have a sister-in-law who believe that because she married in February 2016, she should have delivered by December 2016. When that delivery does not take place, when they give her a call, the first thing they ask, how is your body? I hope God is working on your behalf. Don't worry, we will celebrate. Little will they know that each time they make that statement, they're just checking up her prolactin level. Allow her be. Now, for the males, it's the same thing.
For the men, it's worse.
It's worse.
I think it's worse because we've had cases where the men are severely under stress 365 days in a year. Okay. I think the men feel the stress more of economic recession than the woman, because the role of provision is handed over to the man by nature. Okay. So his inability to provide, he loses sleep, he loses everything. And most times, if you take the sperm count of such a man, you don't find anything. Wow. Yes. So for men, it's worse. When they're under stress, if you take the sperm, depending on the level of stress, a man can go from a normal sperm count to 0. That's why you notice that the people that do detoxification, acupuncture, and some sort of stress relief, they advocate for men a lot, because they know, and it's been proven, that when they go through some of these therapies, you now find out that the stress level is reduced, and it shows ultimately in the sperm count. And men find it difficult to control stress, because by nature, women are easier they control their stress levels better, maybe because of the level of estrogen. But for men, they internalize stress. So everything is right inside, and just the way it affects them right there, it tells on their testes as well. So sometimes it knocks it off completely. That part of their brain don't function, and you realize that when you take the sperm, you don't find anything in it. But the good thing is, if it is stress related, once you control your stress level, ideally it is reversible. So for men, you realize that most times people that tend to have problems with fertility are usually within a certain cadre more. Pastors, you know, politicians, people that do some certain, you know, long distance drivers. So if you look at these jobs, you work in the oil rig, you notice that most of these drugs have a lot to do with mental stress. So if a bank executive, a top bank executive is more likely to be under stress more than his junior counterpart. And if you look at this, if you have to take the sperm parameters of these two people, you would notice that the person that has a higher stress level will automatically have a lower sperm count. So most times we always advocate, you rest. Give yourself a little bit of breathing space. You need it for the proper functioning of your testes.
Okay, maybe I'll talk about, I think we have to deal with stress. And so that's how the world is.
That's a lot much easier for you to say when you have information. Most people don't know. Because for male infertility, you're looking at cortisol and testosterone. These two hormones, they don't joke.
Okay.
They don't joke.
Yeah, my question is on the vagina. Can using water alone, is it enough to wash your vagina, or using some drops of Dettol, to your water to wash it? Does it have any effect, the Dettol itself?
You spoke about smoking and alcohol. I was actually waiting to hear sugar. So I wanted to know if sugar affects a man or a lady's infertility.
The vagina contains microorganisms, and there's a balance. God made it that way. No vagina is sterile. God did not intend it to be sterile. That's why when a woman takes some very potent antibiotics, one of the things she will experience is vaginal itching. Because when you take away all those bacteria, you leave the fungal organisms and some viruses to thrive. It's like you go to the bush. When you remove all the rats and rabbits, and what do you expect? then I don't know, you change the ecosystem.